Hey everyone, Dr. Emily Savage here with Revive Upper Cervical Chiropractic, and all month long we have been talking about heart health. So heart disease is one of the leading causes of death in the United States, and according to the CDC, almost half of all Americans have at least one of three key risk factors in developing heart disease. So those are high cholesterol, smoking, and high blood pressure. So today I'm coming to you with a pop quiz. Upper cervical care has been shown to be as effective as how many blood pressure medications? So a little bit of background on this question. There was a study done back in 2007. There were 50 patients that were selected from upper cervical offices who had high blood pressure. Now, 25 were randomly selected to receive true upper cervical adjustments, and the other 25 were receiving a sham or a fake adjustment. So nobody was taking any high blood pressure medication at this time, and the study went on for about 8 weeks. So all throughout the study, nurses were taking blood pressure, and nobody really had any idea who were the ones receiving the true upper cervical corrections and who were the ones receiving fake adjustments. So at the end of the 8-week study, it was found that the patients who were actually receiving upper cervical adjustments had a drop in their blood pressure by about 14 points in the systolic pressure, so that top number, and then by about 8 points in the diastolic pressure, which is that bottom number. So all in all, those changes are the equivalent of 2 blood pressure medications, which is a pretty significant drop. Now, a lot of us know people who have high blood pressure, maybe people that are taking blood pressure medications, maybe even somebody who has low blood pressure and just difficulty regulating blood pressure, heart rate, and those kinds of things. There are a multitude of things that can cause these types of disorders and symptoms, but one of them really may be a misalignment at the top of the neck where the weight of the head sits on the neck. If we were to look at a model of the head and neck, at the base of the skull we have our brainstem, and the brainstem is responsible for running a lot of those background processes of their body, one of which is regulating our blood pressure. So as the brainstem leaves the skull, it transitions into the spinal cord. So the very top bone of the spine, the C1 or the atlas, is kind of the protector of that connection point between the brainstem and the spinal cord, and really kind of just the communication between the brain and the body. Now, also in the neck, we've got little loops in those bones that are responsible for kind of carrying blood vessels up in to serve the brain. And so if there's a misalignment at the top of the neck, it can obviously affect kind of the communication between the brain and the body, but also it can affect the function of those vessels. So there are more than one way that really people can end up with high blood pressure as a result of a misalignment at the top of the neck. So if you have any questions for me, whether it's about blood pressure or upper cervical care in general, please leave them in the comments. I'd love to answer them. But also, if this video resonates with you or kind of brings somebody top of mind to you, share this video with them, because this is a really neat study that doesn't get talked about nearly enough. I'm one of those people that thinks anybody could benefit from having the alignment of their neck checked, but certainly when people present with symptoms like these, it becomes even more important. So thank you so much for watching, and we'll see you soon.